subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. We are sure you've had a great Diwali and a good beginning to the new year, those who are observing it post Diwali. And, we thought that this would be a good occasion to have a session by Dr. Pranav Ghody, whom we have here today, to talk about issues about staying healthy and managing diabetes. So this is a season where there's a fair amount of festivities and a lot of mithai and a lot of sweets that come in, starting from now to the New Year's celebration. So it would be a good topic to have today. Plus, there was the World Diabetes Day, which is observed on November 14th. Interestingly, coinciding with Children's Day. Before we start the session, before I say hello to Dr. Ghody, let me introduce him. Dr. Pranav Ghody is a consultant endocrinologist and a diabetologist. He completed his specialization in internal medicine and also endocrinology, diabetes, and metabolism from New York, and practiced there for 7 years. He treats a wide spectrum of endocrine and metabolic disorders and has a special interest in treating thyroid, parathyroid, and metabolic bone disorders. Dr. Ghody is a member of leading medical organizations in the US and in India. And as I mentioned, this session is being done on the occasion of World Diabetes Day, which happened on November 14th. Welcome to Health Live at Seniors Today, Dr. Ghody. How have you been?
Excellent. A very good evening to you and to all the viewers. Thank you for inviting me on such a great platform. And Happy New Year to all of you who celebrate Diwali. I'm very happy to be a part of this Seniors Today platform, and hopefully I can guide some information to your audience.
Thank you very much. Doctor, your voice is slightly on the lower side. If you can speak a little louder.
Okay. Sure.
Great. So, Doctor, before, as we always do, we invite our doctors to make a presentation. And those of you who are here and who are still joining in, as always, please put in your question with your age and gender, and I will put them on to Doctor after his presentation is over. Doctor, tell me something. How you've been seeing this the situation every festive season, and you've also spent time in New York, etc. Is the prevalence of diabetes, does it really increase every festive season?
Very good question. I don't think we have data to answer that, but I think overall the number of people with diabetes has been unfortunately exponentially increasing in our country and worldwide. So I think festive seasons do play a role in it, but I think a lot of other factors also go into it. So yeah, festive season is one of the factors, but unfortunately, as I'll show you in one of the slides, the numbers are just staggering.
All right, over to you, Doctor. Please share your screen. And as I said earlier, as Doctor is switching on to his screen, please put in your question in the Q&A tab with your name, with your gender and your age, so that Doctor can give a considered response later. Over to you, Doctor.
Thank you. So a very good evening to everyone. Today's topic is managing diabetes. And this is again on the occasion of World Diabetes Day. My name is Dr. Pranav Ghody. I am a consultant endocrinologist at Oak Heart Hospital. So we're going to start by talking about diabetes, right? So why talk about diabetes? Unfortunately, we have some really bad news. As per the recent survey from July, about 11% of the population suffers from diabetes. So that's about 10 crore people. Another 15% suffer from pre-diabetes. So these are people whose sugars are already borderline high, and if nothing is done to them in the next few years, they are going to end up having diabetes. And another subset of the population, so 40% of the population has obesity or weight issues. And a lot of these people may already have some form of glucose intolerance in form of pre-diabetes or diabetes. So, but they are the people that do not have diabetes they are certainly at a very high risk for developing diabetes. So the numbers are really staggering. 1 in 4 people in our country suffer from some form of glucose related issues. And diabetes is not the main issue. I mean, diabetes causes complications, which are the problem. The end organ complications is what eventually makes people suffer a lot and unfortunately kills a lot of the population. So, as most of you all may be aware, diabetes affects each and every organ in our body. So, number one cause for heart attacks is diabetes. Number one cause for kidney failure is diabetes. Number one cause for stroke is diabetes. Number two cause for blindness in our country is diabetes. Amputations, people get nerve damage because of this, pregnancy related complications, and sexual dysfunction. So a lot of these complications is which we are trying to avoid or reduce, and they controlling the diabetes has a direct impact on it. So this is just one slide. If we lower the A1C, which I'll talk about later on, by just 1%, we can reduce these complications by a substantial amount. So 20 to 40% reduction in the complications, and that's what the goal should be, to control the blood sugars and eventually the complications. So enough of the bad news. We will talk about something else. Just a brief overview of what exactly obesity is, because that's what I mentioned before. So obesity, so people, 40% of us face weight-related challenges, and this is defined by calculating a formula called the body mass index. And this takes into account your weight and your height. And so people who have a body mass index until 23 are considered normal. 23 to 25 are considered overweight in our population. And obese is when the body mass index is more than 25. Or another way to define obesity is the waist circumference. So if you measure your waist circumference, and if you are more than 35 inches as a male or more than 30 inches as a female, you unfortunately fall into the obese category. So the implication is, when the BMI is higher, or if the waist circumference is higher, you are at a very high risk of developing type 2 diabetes. And so, what are the symptoms of diabetes, right? People may not be aware of that they have diabetes. So, learning about the symptoms gives them a clue. So, if you're getting thirsty a lot, if you're passing a lot of urine, if you're sleepy all the time, or if your vision is getting blurry, or if you're getting hungry all the time, or if your wounds are taking much more than longer to heal, these could be related to diabetes. So, and that's where the next step is to get some blood tests done to confirm whether this is diabetes or not. And we need two blood tests over a span of a few days, few weeks, or few months to be abnormal to label somebody as diabetes. And one of the tests is the fasting blood sugar. So when somebody has not taken any food for more than 8 to 10 hours and you do the morning sugar, if it's more than 126, or if we give you a glucose solution and your sugar after 2 hours is more than 200, that's abnormal. Or if we do the A1C test, that's the 3 month average, and if it's more than 6.5, that's considered abnormal. Or if somebody comes into the clinic with having one of those symptoms that I mentioned earlier, and the blood sugar is, we check the random blood sugar and it's more than 200, then this is abnormal as well. So again, you need two of these tests to be abnormal to be diagnosed as diabetic. So once we have diagnosed somebody with diabetes, how do we manage them? And then really there are 5 pillars for this. The first is healthy eating, physical activity, monitoring your blood sugars, medications, and then follow-ups. Now I'm going to skip over the medication part and we'll go over the rest of it a little bit more in detail. So regardless of uh, what the management for diabetes is if the somebody has weight related issues, if somebody is overweight or obese, uh, there is ample evidence that shows that if you are able to lose 5 to 7% of your body weight and keep it down, you can control your blood sugars much better. So that's the primary goal for somebody who comes into the clinic who has some weight related challenges. We want to try to encourage weight loss 5 to 7% and try to maintain it there. And so how do we approach that? So that starts by eating healthier. And the recommendations from the Indian Council of Medical Research is that we should be consuming about a milligram of kilogram body weight of protein every day. So if somebody is 60 kilograms, uh, then they should be consuming about 60 kilograms of protein. But unfortunately, about 80% of our population is deficient in protein. A lot of it is related to myths that vegetarian food is not high in proteins and so forth. But that really needs to change. Our meals are unfortunately very predominantly heavy in carbohydrates, and that's one of the reasons why we are developing obesity, diabetes, and all the metabolic issues in such high numbers. So this really needs to change over time, and this would come by following a healthier eating pattern. And so this is what we call a diabetic plate. So this is a 9-inch plate, and if you look at it, half of the plate is filled with vegetables, and these are non-starchy vegetables. So potato is out, squash is out, corn is out. Quarter plate should be protein, and this is where we are lacking for a lot of the population. And a very small portion, quarter plate, should be carbohydrates, and preferably complex carbohydrates, which take a little bit longer to digest. And we'll expand on this a little bit more. So the good source of proteins and complex carbohydrates are millets. So this is ragi, this is jawar, this is bajra. They are also high in fiber and antioxidants. So we should try to switch over or at least include some of them in our daily intake. The other source of protein and fiber is beans. So chickpeas or chana, chole, rajma, and these are soya beans, very high in proteins. Again, incorporating them in our diet would help to reach that protein goal for most people. And then we have other alternative sources of proteins. So this is paneer for vegetarian people. Uh, Another alternative is tofu or quinoa. For people who do consume meat, baked chicken, baked fish, eggs are high sources of protein. So the idea is to try to consume protein for every meal. And in between snacks, you can consume peanuts or any other form of nuts like walnuts, pistachios, almonds. These are, along with protein, they are also high in mono unsaturated fats, which is the good fats, and some vitamins and antioxidants. Last part is dals. So our dehusked dals, so moong dal, chana, whole chana, masoor, loya. These are all again high sources of fiber that people need, and along with that, antioxidants. So I frequently get asked a question about fruits. And the way to identify fruits would be to select fruits which are low in the glycemic index. So glycemic index tells us how the quality of the fruit is, or any food is. Whether the blood sugars are going to rise really high after consuming that. And so these are some of the fruits that are low in glycemic index that can be consumed by people with diabetes. And so that would be orange, guava, strawberry, cherries, avocado, plum, apple, and peach, depending on the season. But the one thing to sort of remember is fruit should be consumed in their original form. Juices are not the same as having the fruits. You lose a lot of the fiber and the antioxidants. Plus, the blood sugars do rise significantly when you use them in the juice form. Also, fruits should be staggered during the day. So, a small portion of fruits in the morning, a small portion in the afternoon, a little bit of fruits in the evening. That's really advisable as people with diabetes. Some things to avoid is all the processed foods, which unfortunately have saturated our markets with the westernization in the last decade. So, pizzas, uh, potato chips, burgers, sodas, all of this, onion rings, all of this really needs to be reduced or avoided if possible. Um, One thing I would definitely recommend people with diabetes avoid is drinking any kind of soft drinks or colas. These are really high in sugar, caffeine, which most people probably don't need. So one thing that you can easily eliminate if you're consuming that is these colas and juices. Uh, Another common question I get asked is, what do you use instead of sugar? Can you use honey or jaggery in your tea, in your beverages, or in your sweets? And the evidence indicates that they all will bring their sugars up as much as the sugar. They do have some other benefits like iron in jaggery, but eventually the blood sugars do go up when you consume honey and jaggery as a substitute. So the better option is to switch to something natural. This is one of the products. This is a plant called stevia, and you can use the powder or you can boil it in water and use it as a sugar substitute. So, summarizing, so a couple of other points about healthy eating. So, you really want to watch the portion sizes. They should be limited, especially the carbohydrates. Try to limit to one carbohydrate per meal in small portions. Uh, Try not to skip meals, especially somebody is on tablets or insulin for diabetes. Some of these medications can cause low blood sugar if you take a long time between the meals. So, you want to space out your meals evenly throughout the day, have some snacks in between or a small piece of fruit in between. And because this was a holiday time, sweets, you want to try to consume them earlier in the day after a full meal so that you are consuming less quantity. And try not to consume them after 6 p.m. Our metabolism sort of slows down as the day progresses. So we should be able to digest these a little bit better in the early part of the day. The next part is physical activity. So any activity is good. uh, Whatever you can do depending on your other medical conditions, your tolerance, any activity is good. But so the more intense the exercise, the benefits are higher. So something that qualifies as light exercise would be yoga or just dancing. Moderate intensity exercise would be playing tennis or swimming or going for a trek. Vigorous intensity exercise would be riding a bicycle, running, or going to the gym. So again, any exercise is good. The more intense you can do, the better it is. And how much exercise should you do? So if somebody has really is at ideal weight, good weight, then the recommendations are to do about 150 minutes of moderate intensity exercise per week. So moderate intensity exercise again is something like swimming or playing tennis. If you're doing something more vigorous, like running or going to the gym, half of that is enough. So that would be about 15 minutes, 5 times a week is usually enough if your weight is good. If you are somebody who's struggling with weight, then you really need to double up. So about uh, 30 minutes of intense exercise every day for 5 days a week, or about 1 hour of moderate intensity exercise. One thing to remember is as we get older, our muscles become weak. This leads to falls, especially in people with diabetes who also have nerve damage. This can cause a lot of the other issues. So, weight training is recommended to prevent the muscles from getting weaker. So, at least twice a week, if you can do weight training, that's really beneficial. Now, I understand not everybody is able to follow these recommendations. So, there are some simple exercises for people who cannot follow. So something like taking a brisk walk for half an hour to 1 hour every day. This does help. Or you can climb the stairs using only the balls of your feet, or push yourself on the wall, stretch your calf muscles, do that a few times. The exercise number 4 is really helpful to strengthen the leg muscles. So you sit down on a chair and try to lift yourself up without using the side supports. So you're using only the leg muscles. Some other exercises, you try to tiptoe after holding a chair so that you're not falling down. And you can bend your legs. Again, it helps to strengthen the leg muscles. Same thing, raising your legs on the heels and then sweeping, doing the legs in a sweeping motion. Um, Again, all included to improve the lower extremity muscle strength. Some other yoga asanas have been shown to be helpful for diabetes. Again, I'm not an expert on these, but these are something that have been recommended, which are Mandukasana, Pawan Muktasan, Bhujangasan, Dhanurasan, Paschimottanasana, and Matsyendrasan. So they may help people with the flexibility and improving the blood sugars as well. So we've talked about diet, we've talked about exercise. The next part is monitoring the blood sugars. And until a few years ago, the only way to monitor the blood sugars was pricking yourself and checking the blood sugars in a glucometer. Technology has advanced, so we do have a new technology called the continuous glucose sensor, which is a little filament that gets inserted in the underneath the skin and stays there for about 2 weeks. So this patch, the sensor stays there for 2 weeks. You shower with it, you do everything that you're doing normally. And you also get another machine called the reader, which you just scan in front of it, of the sensor, and you get a reading instantaneously. So instead of poking yourself multiple times a day, you can get a blood sugar reading instantly and do that almost unlimitedly. Obviously, the cost is a barrier for a lot of the people, but hopefully, as time goes by, this will become cheaper. So, benefit of using a continuous glucose monitor is it gives you a pattern. It gives you an idea of what's happening to your blood sugar levels. So, just to give you an example, so these dots are the blood sugars that were checked with just the old way glucometer. And if we take this reading, the blood sugar was 250 and the previous reading was 130. But we have no idea whether the blood sugar went from 130 and it's continuing to go up beyond 250, or it went from 130 to 200, 250, 300, and it's now starting to come down. So that graph can be given only by a continuous glucose sensor. So when we take all of that data together, we get a nice little graph which tells us over a period of a couple of weeks uh, some of the readings are in the good zone, the green zone. This person has been struggling with some high sugars after food. During the daytime, and so the blood sugars are struggling going up after eating. And then there are some low blood sugars in the middle of the night when the person's not even aware. So may need some adjustment of medicines, may need adjustment of eating habits. Consuming carbohydrates probably too much, so needs to reduce carbohydrate consumption, especially dinner time and later on. That's the benefit of using a continuous glucose sensor. Um, Now, how frequently do you need to check blood sugars? So this is for people who are not using continuous glucose sensor and using a glucometer. This all depends on what kind of medications you're using for diabetes. So if you're somebody who's requiring multiple injections of insulin a day, 2 to 4 injections of insulin, you need to check your sugars much more often, about 4 to 6 times a day. So that would be in the morning, before each meal, before going to bed, and occasionally 1 to 2 hours after meal. Now, this can be cumbersome, I understand, but this is the recommendation. For somebody who's using just one injection of insulin per day and some tablets, checking the sugar early in the morning is usually enough. And if you're somebody who's using only tablets, there is probably not a real need for checking the sugars, but you can check the sugars once or twice a week, fasting and occasionally after meals. But this all changes if you are sick. So let's say if you have a fever, or if you had a viral infection, or if you had some sort of inflammation and the doctor gave you some steroids, or if you are experiencing low blood sugar symptoms, then you need to check the blood sugars more frequently. Um, a quick word on the test A1C that we do frequently. So this is just a basic test that gives us an idea of how your blood sugars have been over a period of 3 months. And and this is usually done every 3 to 6 months in the lab. And our goal is to try to keep around 7%. So these are our targets for most people. Again, we try to individualize it depending on the health status and some other medical complications. But in general, the target is to keep your blood sugars in the morning and before you eat between 80 to 130. An hour after you eat, uh, less than 180, and that A1C 3 month average, we try to target less than 7%. And keeping the blood sugars under this level eventually reduces the risk of complications, as I had mentioned earlier. I'm going to skip over the medications unless the somebody has specific questions. So, foot care. This is very important for people who've had nerve damage related to diabetes. So, if you're getting tingling, numbness, burning in the feet, if you're not able to sense everything, this is a symptom of neuropathy or inflammation from the diabetes. and you really need to pay more attention to your feet. So you need to take care of, wash your feet every day, look underneath at least once a day with a mirror, just to make sure there is no uh, pebble or anything, a small pin. People quite often don't realize there is a wound there until they start having blood on the floor. So we don't want to wait until then. And so if you've had diabetes related nerve damage, it's a good idea to keep wearing some form of footwear even in the house, so like a slipper or something, or some form of shoes. If you're going to the beach, do not walk bare feet. And most important thing is try to stop smoking if you're somebody who's smoking, because this causes a lot of vascular damage, blood vessel damage, and this causes ulcers in the feet, which eventually need to be, which leads to amputation. Now, summarizing, so how do we reduce the risk of complications that come with diabetes? So we try to maintain a healthy weight. We want to eat a balanced diet, low in carbohydrates, higher side on the protein, engage in regular physical activity. Any form of activity is good. Try to avoid smoking and alcohol, and then regular checkups and screenings. So, as a part of diabetes screening, diabetes follow up, we want to make sure everybody gets an eye checkup to look at the retina, the back of the eyes, every 1 to 2 years. Foot exam at least once a year by the doctor to make sure there is adequate circulation, no signs of nerve damage. Kidney checkup in the form of blood and urine test at least once a year if it's normal. A dental exam. So a lot of the times people tend to miss this, but diabetes causes gingivitis or inflammation of the gums, and this causes people to have decay in the teeth and eventually requiring implants and surgery. So we can avoid that by getting periodic dental checkups at least once a year. And then vaccinations. So these are very important. During COVID times, we realized that people who had weight issues and people who had diabetes, these were the two subsets of people who had the most complications from diabetes. So because diabetes is a immune compromised state, so you are more likely to get any sort of infection if you have diabetes. So thankfully, we now have vaccinations against few of the common illnesses. So a flu vaccine and influenza vaccine, it's now available in India every year. It is recommended because the uh, mutant strains change of the influenza virus. And the time to take the influenza vaccine is before the monsoon, because in that's the peak season here in the northern part of the country before winter sets in. Pneumococcal vaccines, there are two of them. They need to be taken every 5 years until the age of 65, and then once after you turn 65. And then every 10 years, you take the tetanus booster. And then, so zoster is the shingles vaccine. So this is the chickenpox virus. A lot of people must have had chickenpox as kids, but that virus stays dormant in the nerve cells. And over a period of time, after 20, 30, 40 years, it gets reactivated. When the immune system has gone down, it gets reactivated and causes herpes. So there is, which is very painful, can lead to a lot of complications. So we have a vaccine against it. It's a two shot vaccine that's good for at least 10 years. So it's recommended for people with diabetes above the age of 50 to take that. And the last part, diabetes is a complex disease. It requires a lot of commitment from the person who has it, uh, often more than one medication, requiring changes in the lifestyle, cannot eat a certain amount of food or different types of food, requires commitment to exercise. So it can take an emotional toll on people. People are often depressed because of that. So if you have somebody who has symptoms of depression, try to help them out, or at least refer them to a doctor or a specialist for that. And I think I'm ready to take questions.
Thank you very much, Doctor. I think a very detailed presentation. And yeah, so those of you who have questions, please, as I mentioned earlier, please put them on the Q&A tab and we will take them. Uh, Doctor, can you put your screen share off? I can then take sample.
Yeah.
Great. Thank you. So we have a question uh, N. Ravindranath from Kerala. He's 79 and he's a diabetic patient. His problem has constipation. Fruits are sweet and he doesn't take it, but my personal doctor advised me to take Roberta fruit. Is this correct? Still, I'm afraid to take fruits. What is the solution? I take oats, eat vegetables only, being a vegetarian. I take only one tablet in the morning called Germa, one per day. Fruit. His question is, uh, one is about fruits. Can dates be taken?
So
That's
dates are, sorry, you want to finish?
that's it. That's it. Yeah.
No. Okay, so fruits, as I had mentioned earlier, fruits are naturally high in sugar, but they also have some other properties, antioxidants. So the fruits that are low in the glycemic index, those are really helpful for people with diabetes. They can, and fruits also tend to have fiber. So pear, apple, these are high in fiber. They can, peach is high in fiber. You can consume that. Dates, probably not a good choice because they will raise the blood sugars a lot. It seems like your diabetes tends to be very well controlled from this that one reading that you mentioned. So I would tend to stick to these low glycemic fruits. The other thing that you should probably do is include those foods that I had shown earlier. Millets, beans, these are all high in fiber, which helps to regulate the bowel movement. So the constipation, which is a very common problem in people with diabetes, gets better when we increase the fiber content in our food. And that's from the millets, beans, dals, even nuts are all high in fiber. So all the foods that I showed, you can try to incorporate as much as you can. Eventually, if that also doesn't help, then adding a fiber supplement, something like isabgol or some isabgol, can be also beneficial.
Right. Thank you, Doctor. For all of you over here, Doctor was referring to his presentation. Now, as always, the edited video of this session will be on the Seniors Today website on Monday evening, along with the takeaways, which, as we know, is written by a qualified medical practitioner. So that will be there on Monday evening. So you can look at the presentation once again, look at all the advisory that he had provided. Doctor, we have a question from Mr. Shrikant Kulkarni, who's 71. He is in the formula of BMI. BMI is equal to WT on HT. What are the units of WT and HT?
So weight in kilograms depends. We can use our standard weight in kilograms and height in meter square or centimeters or inches. The If you go on any Google website, you can you can just type in calculate BMI, and they will adjust for whichever metric you're using, whichever unit that you're using. It can automatically adjust for it.
Right. Thank you. We have a question from Mr. Satish Kalia, who is 78. He has had diabetes in the last 12 years. He is
Hmm.
on linagliptin for the last 5 years, well controlled A1C below 7. His question is, can he stop medication? Before you answer this question, I must just advise all our uh, viewers, attendees over here, that while doctor is going to give you some advice, it is best that you take advice in person from a medical practitioner in your city, in your town, and that's always better. But of course, the advice over here is there, but it can change from person to person. So it's always best to get in-person advice from a medical practitioner. Sorry, doctor, over to you.
No, I absolutely agree. Because I am not aware of the full history of Mr. Satish. So, because we do need to take into account the rest of the medical problems, his weight, whether there are any other comorbid conditions, whether the kidneys are functioning fine, and a lot of these factors do need to go into decision making. But from what information he has supplied, um, I mean, I wouldn't. So diabetes, unfortunately, it's a progressive disease. The pancreas, the cells that produce the hormone insulin, over time may deteriorate, um, and the production of insulin can go down over time. Uh, so what that means is, if we stop the medication, there is a very good chance that the sugars will go up and probably may go up higher than what it was before. So we generally do not recommend stopping the medication in most cases unless you're getting a low blood sugar or so. And linagliptin does not cause low blood sugar. So you should be, I mean, you can safely continue that.
Doctor, we have a question which I've got from SMS. Can you ask doctor that diabetes, some of the diabetes medicine are very expensive. Is it all right to take generic drugs?
Yeah, good question. I think for the most part you can. I am not big on advertising a particular company or so. The generics are for the most part equivalent to the brand names. So certainly you can consider switching to the generics. But what I would advise is once you've made the switch, probably do some blood test, check your sugars at home, and do an A1C after a few months just to make sure that your blood sugars have remained stable. Sometimes we've seen that when we switch from the brand names to the generics, the blood sugars sort of go up and down, quite often up, and then we probably have to adjust the dose or switch back to a brand or a different medication. So whenever switching, always follow up with some blood tests to make sure medication is doing its job.
That's a very important advice. We have a question from Mr. Bharat Mehta, who's 66. After going through health checkup, doctor has suggested to take medicine, glyciphage 500 mg, one in the morning, one in the evening for 3 months. His report says 134. What precautions can one take for changing the lifestyle? Of course, you've mentioned this in your presentation, but is there something that you can advise Mr. Mehta?
So the most important thing is to start cutting down carbohydrates. Identify carbohydrates in the food. So most commonly carbohydrates, roti, chapati, anything made from rice or flour is a carbohydrate. So bread, pav, rice, uh, uttapam, idli, these are all carbohydrates, and we need to start cutting those down and on the simultaneously increase the protein intake. Once you, if the kidneys and everything is functioning fine, protein intake should be increased. That is the most important thing, and in addition to doing some form of exercise, that will help bring the blood sugars or at least stabilize them.
Right, thank you. We have a question from Mr. Mahavir Hachare, who is 69. He has diabetes since 10 years, under control with medicines. Uh, he wants to know what is the pre and post maximum that is okay for his age. And
So,
this is a question which somebody else also has asked as to, because in the past we've also heard that if a person has developed diabetes at the age of, say, 65 or 70, then the levels could well be higher. Is that so?
So there is some truth to it. So again, the goal is to individualize the targets for everybody. But 65 and 70, I mean, is the new 40, I would say. Everybody, the lifespan has increased. People are living much longer. So we do not want to keep the blood sugars high if somebody is 69, healthy, otherwise has no other medical issues. On the other hand, if let's say somebody is 70 but has a terminal disease like cancer or something, metastatic cancer, then the targets can be more lenient. Then we do allow the blood sugars to be a little bit higher. So it all depends on your underlying health, other medical complications, and age is just a relative term in that. Um, so the first question that Mr. Mahavir had asked, the targets would be similar for him, would be similar to everybody else. In the morning, the blood sugar between 80 to 130, and before meals the same, and after meals, 1 hour after meals, 1 to 2 hours after, less than 180.
Right. Okay, doctor, this is a question which is slightly longish. He says, Doctor, it is impossible to get across to my uh, diabetologist because he's so busy and he's part of a hospital. My sugar levels went down considerably after I started my medicine, which he had changed. What should I do? Is it possible to get advice from somewhere because all of you doctors are so busy?
Yeah, unfortunately, that's a fact. Because a lot of people in our country suffer from diabetes, and the number of doctors available to treat are much less. But what I would suggest is, I mean, depending on which medication it was, sometimes we can lower the dose. If it was an insulin, we can lower the dose by a couple of units, and that can help stabilize the blood sugars. If it was a tablet, using a lower strength of the tablet can be helpful. Uh, in this day and age, I think you can, if you are not able to go to the doctor in person, you can easily request a virtual or a telehealth or a video visit with that doctor or somebody else. I'm pretty sure there are a lot of doctors that do video visit, including myself. So a lot of the doctors would be able to help you out. Because I don't have the specific name of the medicine or uh, that he's taking, it's hard to advise how much to reduce.
Absolutely. Doctor, we're running out of time, but we have a couple of questions which I'm going to ask. One is from Sangappa Koti, who's a friend turned to vegan food and he claims his diabetes has been reversed and blood sugar is normal. His father, with over 30 years of history of diabetes, also turned vegan and they claim both of them are off medicines, their sugar levels are normal. Is it possible to reverse diabetes by going vegan?
So there is some evidence that people who've gone from a very high carbohydrate diet to no carbohydrate diet, keto diet, or vegan diet sometimes can get their sugars under very good control, what we call remission, and may not require medicines. We don't have long-term. Short term, yes, there is evidence that people can get their sugars under control. Long term, we do not have answers. So sugars may be good for a few months or maybe a year or two, but eventually they will rise probably. This is what the natural history of the disease is. So you can certainly try if your kidneys and everything are functioning fine, but monitoring the blood sugars is very important because, as I said, there is a good chance that the sugars may rise maybe a few months or a year or two later. But this is not a permanent reversal as far as we know. This is what we call a state of good control called remission.
Right, thank you. We have a question from Shamala Ravi. Her question is, what is the cause of juvenile diabetes and can it be reversed? And another question that she asks is the new normal for HbA1c supposed to be high? Is it acceptable? So the first question is, what is the cause of juvenile diabetes and can it be reversed?
Sorry. So juvenile diabetes, the correct term is type 1 diabetes. And this is a condition where the pancreas uh, is attacked by its own. The body thinks the pancreas is a foreign object and it starts attacking the pancreas by producing antibodies. So that causes the body to produce less and less insulin over time. So this is an autoimmune disease. Um, there is no, unfortunately, reversal for this. There is a medicine approved in the US last year, US and Europe, which has been shown to delay um, type 1 diabetes in siblings, brothers or sisters of people who have type 1 diabetes. So that is something that has been approved. It's not available here yet. And in terms of the A1C target, as I said, it depends on the underlying health issues. Age is just one of the relative factors that we use. But for most people, if you're healthy, A1C target is still less than 7%.
Right. Thank you very much, Dr. Ghody, for taking time out and for uh, you know answering all the questions in much detail. Your presentation was excellent. Um, Thank you very much for being here, and thank you to all of you here. We will be back once again next Saturday at 5 p.m. for another session of Health Live at Seniors Today. But before you go, and before you go, Doctor, I'd like to just ask our producer to play a short video which has the latest issue of Seniors Today. The latest issue of Seniors Today was out, as always, on the 15th of the month, that is November 15th. And we'll just do a quick screen share of the issue. There's an interesting issue which we have, the November issue. We have a senior citizen talking about how to brace oneself for with old age. We have a question. We have an essay by Mr. Harsh Goenka. We have a new column by Dr. Monica Das. Those of you who are regulars here would be familiar with her. There's an article on wellness by Vinita. Boris, fitness by Bob Suresh, and a travel article on Vietnam by Malti Gaikwad, and of course a story from Mr. Nagesh Alai that he runs every month. So this is our issue of Seniors Today. You can, of course, look at the archives, all the 53 issues that have been published, and this is on the Seniors Today website, which is accessible free of cost. Once again, I must also alert you that we have the Evergreen Club, so which you can become a member of, again, free of cost, no conditions apply, and you can download it on your Apple or Android devices and access the various programs that we have Monday through Sunday. So that's it. Our 13th season of Seniors Have Talent starts on November 22nd. On November 22nd, our 13th season of Seniors Have Talent starts. And those of you who've been here, who are aware of it, please join us again on the from the 22nd, which is a Wednesday. It's going to be there at 5 o'clock every Wednesday evening, so you can tune in to our website and to the relevant Zoom window and access it from there. Thank you once again, Dr. Pranav Ghody, for being here, and thank you to Wokhart Hospital for facilitating this. Thank you once again, and all of you there, please take care of yourself, and we'll be back again next Saturday at 5 p.m.
Thank you.
Subscribe now and press the bell icon. Never miss an update.